Welcome to Geetika Ki Canadian Diary. Joining me on my podcast today, I have the award winning pain specialist and the author of two books, Eight Steps to Conquer Chronic Pain. Second one, You Are Unique, and So Is Your Pain. Dr. Furlan, thank you so much for joining me today.
I thank you, Gitika. It's a pleasure to be here today talking to you and with your audience.
And congratulations on the release of your second book.
Thank you.
We're going to talk about a topic that many of us are either confused about or don't want to acknowledge even to themselves. I forget about talking about it because they may be fearing either being judged as weak, complainers, or just lazy. So, my very first question to you is please explain what is chronic pain?
Mm-hmm. Yeah, and you're right. Many people who suffer from chronic pain, they are stigmatized. They are seen as sometimes drug seekers, lazy, they don't want to work, or psychologically weak. Yeah, you're totally right. And it is a disease. Chronic pain is a disease, we know now. It's different from acute pain. So if you allow me a little bit of an explanation here, what is pain? And I need to talk about what is pain first before I talk about chronic pain.
Mhm.
So pain is a sensation that we all have. I think we all experience pain at some part of our lives. And our brain receives that information and interprets the sensations as pain. When something is broken, damaged, there is a disease, a lesion somewhere in our body, an inflammation. And then the brain is the one that interprets the sensation and says, oh, this is pain. And then it makes it unpleasant. So definition of pain is that it has to be an unpleasant sensation, because if it was pleasant, you would not seek care to fix that problem. This is acute pain. This is because pain is the alarm system of our body. This is similar to an alarm of a house that is just, going off because there is a fire in the kitchen and you need to call the fire department. So that's mostly acute pain. That's not chronic pain. So think about like this. Think about if pain is the alarm of our house or alarm of our body,
Mhm.
the other thing that can trigger the noise, the alarm can go off, is if there are maybe some short circuits in our body, like you open the cupboard of your kitchen and then suddenly the alarm goes off. And every time you open the cupboard, the alarm, there's a short circuit somewhere. You're not going to call the fire department. You know there's no fire. You call the electrician.
Mhm.
This is the type of pain that we call neuropathic pain. So the first pain that I mentioned to you when there's a fire in the kitchen is more like an inflammation, a broken bone, appendicitis. The second one is more like a neuropathic pain when the nerves that carry the information about pain, they are somehow not functioning well. This could be shingles. This could be a carpal tunnel syndrome, could be multiple sclerosis, so problems in the wires. Now, the third type of pain that the alarm of the house can go off is when the alarm itself is malfunctioning. And this is the most common type of chronic pain. There is no fire in the kitchen. There is no short circuit that you need to call the electrician. You need to call the alarm company because the alarm is going off for no reason. It doesn't mean that the pain is not real. The pain is very real. And the worst is that this pain is constant and the volume is up. So the volume dial is turned up. So when people ask me what is chronic pain, I give this long answer is just for them to think that they are feeling something their brain is interpreting as pain. Yes, chronic pain means that it's constant, ongoing. It's there for at least 3 months. The volume of this pain is turned up, so they feel more pain than normally we would do with a broken bone.
Mhm.
And they go from doctor to doctor, MRI to MRI. They do all kinds of tests. They try everything and nothing works. And that's because it's equivalent of calling the fire department or an electrician every time that the alarm goes off in your house
Yeah.
when you should be calling the alarm company.
So, talking about going back to doctor offices again and again, I kind of want to bring up another point. In our healthcare environment where prescriptions, steroids, painkillers are so easily prescribed, and instead of someone taking time to do the assessment and join the dots between mind and body, you talk about in length in your book. Why is our healthcare system sometimes a circle of no destination for the patient? So it becomes a vicious cycle. You kind of start, to be honest, judging yourself like, what's going on with me? There is no answer coming after blood tests, after diagnostic tests, after my multiple visits to the clinic. And you kind of want to pause and say, I don't know what's going on with me. So, at what point do you really need to advocate for yourself and say, I really need help? I don't think this is going anywhere. How do you approach that question to a doctor?
Yeah, you're totally right. The problem, Gitika, is that this knowledge that I just mentioned to you about the three types of pain, I didn't invent those
Well,
things. This is science. This comes from international groups of scientists, clinicians. These three types of pain, nociceptive, neuropathic, nociplastic. The majority of family doctors, generalists, and other specialists, they never heard about this. They don't know that there are three types of pain. And so they are trying to do the best. They are using what they know to treat pain, but what they know is how to treat acute pain. Most doctors in medical school, in residencies, they learn how to treat acute pain. But acute pain is equivalent to that fire in the kitchen, or maybe that short circuit in the wires. So most doctors know about these two kinds of pain, and they try to use the same strategies that work for nociceptive and neuropathic pain to treat a chronic pain. But more than 90% of people with chronic pain don't have nociception anymore. They don't have neuropathic pain. They have nociplastic pain. It's a malfunction of the alarm system. And it's not going to work. It's not going to work because, again, it's like calling the fire department. They come, they say there's no fire in the kitchen. And a lot of people don't know first how to diagnose nociplastic pain and how to treat nociplastic pain, which requires all of that retraining of the pain system, lose the fear of pain. A lot of people have fear of pain because it is built in our brain. If you have pain, you must have fear, you must have something wrong, so you need to go and fix it. But in the case of nociplastic pain, it's not true. So you need to decouple those neurons, that synapses that was made in the brain.
yeah.
And what should the patient do if they suspect, if the person is listening to this and they have chronic pain, let's say more than 3 months, the injury has healed, the surgeon went there and fixed the problem, and you continue having problems. Some people with knee replacements, hip replacements, they keep having chronic pain for the rest of their lives, and they go to the orthopedic surgeon, they look at the x-ray, they say, but this is perfect. There's nothing wrong with your hip, your knee. Why are you having pain? 6 months later, 6 years later, 20 years later. So if a person is in that situation, what they need to do is get some knowledge about nociplastic pain. Go and read about nociplastic. Another name, synonym is neuroplastic pain.
Mhm.
And ask your doctor, do I have nociplastic or neuroplastic pain? And if the doctor never heard about this, find another doctor who knows what this is, but maybe this is what you have. And I would say it's so satisfying when we diagnose someone with nociplastic pain and we give them the right treatment because they get better,
Yeah,
get a lot
I
better.
would think that makes a whole lot of difference in that person's life. Um,
Yeah.
Another question: do men and women experience pain differently?
Men and women?
Yeah.
Yes. A lot of scientific studies are published showing that there are genetic and hormonal differences between men and women, but those explain the differences very little. What explains more it's not just the sex and the hormones, it's more the social, the psychological and social aspects of a person's life. We know that the pain is biopsychosocial. There's a biological component, a psychological, and a social component. In chronic pain, the psychosocial are much more influential on how much the person says that they have pain, how much they can tolerate pain, and you can modify that. So, for example, answering your question, the biological component of pain, which is tiny percentage of how pain is felt differently by sex, tells us that women, if you do the same stimulation, a person who was a female at birth, will feel more pain, will say that they have more pain. The pain is more intense than a male.
Hmm.
Okay. But now we also know that the same female, if you bring that woman or female to the laboratory and you change the psychosocial environment around her for the same stimulation, you don't change the stimulation, you apply the same stimulation, she will feel pain differently.
Oh my God. Seriously.
Yes. So yeah, there are amazing experiments. Like they bring a person with their partner to be tested for pain, and believe it or not, there are volunteers who come to the laboratory to be exposed to pain. And they bring these people. They bring couples, romantic couples, or people who just know each other, and they do experiments. And it's fascinating because when a person is alone without a partner, they feel more pain. And when they are in the presence of their partner for the same stimulation, they feel much less pain. I'm not saying about a little bit, but much less pain.
Much less, right?
And also, depending on what the partner says, they will be more empathic. And then the partner may also feel their pain.
Oh, wow.
Yeah, they show this with images of the brain. So they were doing images of the brain at the same time that they were doing these experiments, and they show women have more empathy for a male partner if they see that partner is suffering from pain. The same areas of the brain will light up. Like you cannot distinguish who is feeling real pain or not because the brain they will light up. Now, men has less empathy if they see the female partner suffering from pain. It doesn't mean that they don't have to. Their areas of brain will also light up, but not so much as females. It's fascinating. You change the color of the room, you change the intensity of pain. So they think that they are getting less because the researchers don't tell them how much they are applying the pain. They say, they change to red. Everything is red. And they apply the same stimulation. The person feels a lot of pain. They change to blue or green. They feel less pain with the same stimulation. They watch a video. For example, if you put people to watch a very scary video before they are tested for pain, they feel more pain. If they watch like a comedy or something very relaxing and they go to the lab to be tested for pain, they feel less pain. So the psychosocial components are much more influential than just the biological.
That is so interesting. I know you have explained in detail in your book, the first book, A Practical Guide to Conquer Chronic Pain. But I wanted you to explain a little bit, very briefly, about how emotions create painful symptoms. Like there's a system to that.
Yeah, yeah, yeah. Very true. So let me start by saying somatization. There's a term. Somatization is a term that we use in medicine, psychology, psychiatry. Somatization means when you have an emotion and your body express that emotion.
Mhm.
We all somatize. You somatize, I somatize. It's normal. It's part of being human. An example is, Gitika, did you ever cry in your life?
Yeah,
Crying, like tears coming out of your eyes. I bet you did, right?
yeah, we do that as a family a lot. Yeah, we get very
Yeah.
very
So,
emotional family.
yeah. So crying, like tears, is a type of somatization. You can, like, nobody's going to say, oh my God, I need to see an eye doctor, an ophthalmologist, because there's running water from my eyes. Something's wrong with my eyes. You
Mhm.
know that if you're crying, it's because you either are very sad or very happy. It's an emotion, and happiness and sadness are emotions, and your eyes are, dripping water.
Yeah,
some people, when they are, if they are exposed to a situation that is very stressful, like let's say an executive who has to speak to 1,000 people, they may have palpitations, they may have sweats in their hands, they may flush their face. That's somatization. That means your body is expressing that stress, that fear. So it is normal that our body express our emotions. It's not abnormal. Everybody relates to that. So why are we surprised when our body express pain with an
Yes.
emotion? So a pain is a physical sensation that can really, be an expression of an emotion. Some people have, like, they're carrying, that's why women probably have more pain than men. It's not just the hormones, but women carry a lot of weight in their shoulders. They have to work, they have to take care of their elderly parents, they have to take care of their children, they have to clean the house, they have to. So I'm carrying a lot of weight on my shoulders. That's an emotion. You're feeling
Hmm.
overwhelmed. Your body expresses by creating pain. Your brain has to have a mechanism to talk to you. Your brain is saying, I'm overwhelmed. You're doing too much. Say no. Take care of yourself.
Yeah. Yeah.
And you're not listening. So your body is going to create pain. It doesn't mean that your pain is imaginary, it's very real.
So that's a good point that you said. It's not just all in mind. It's when somebody says that, especially a medical team a member would say that to the patient, I think it just discourages that person to go and ask for help again. Then, and when you don't get the answer to things like pain, you don't want to keep going back to the clinic again and again and come back and feel discouraged and think, what's going on? So I have noticed, personally witnessed this, that when a vicious cycle like that happens, people tend to start looking for answers and solutions in other areas. Um, and I'll tell you example. For example, they'll like you start noticing their kitchen shelves getting decorated with vitamin bottles, and sometimes maybe that's a way they're trying to figure out, how can I take care of my pain on my own? Maybe this will help. Do vitamins really help with pain? And what kind of pain do they help with?
Mm-hmm. Yeah. Um, so that's a big topic to talk about vitamins and supplements. It's huge because there is an enormous, gigantic industry behind the supplement and vitamins industry who are trying to convince people that they need to take all kinds of vitamins to take care of their health. I don't agree with that. They're all making profits out of people's despair. They're making profits out of people's attempts to get better. It's not true that we need to take all of those vitamins that we see now in the grocery shops, pharmacies, everywhere. It's not true. A person should be able to get all vitamins, supplements, and minerals that they need from a healthy diet. That's the best way of getting everything. Having said that, some people have deficiencies they can't absorb because they have celiac disease or they have some sort of inflammation in their guts, like inflammatory bowel diseases or Crohn's disease, or they have other conditions that they will need some specific vitamins, some injections of vitamin B12, or if you live in an area like we live in Canada, and if you live in an area that there is very little exposure to sunlight, and you don't eat many of the milk and butter and yogurt that is sold in Canada has supplementation of vitamin D. But if you don't eat those things, then you need vitamin D. Other than that, Gitika, it's basically healthy nutrition. You don't need anything else.
How does sleep help with pain? Proper sleep.
It's the, it's the, I tell my patients, sleep is your free medicine. I can't help someone with chronic pain if their sleep is extremely disrupted, they don't have a routine, They don't take care of, the basic aspects of sleep hygiene. I can't. I tell them, I refuse to prescribe a medication for them, especially to help them with sleep, if they don't take the basic steps of sleep hygiene. And that's the third step in my book, the 8 steps.
Mhm.
I tell them, sleep is extremely important for our health, for our quality of life. And humans, we are the only animals that we mess up with our sleep. The other animals, when they are sleepy, they fall asleep and they don't care where they are, what they are doing. They just sleep.
Mhm.
Humans, we mess up the routine. We avoid sleep. We sleep less. Sleeping a lot is also deleterious. It's very harmful to our body. And if you want to provoke someone, like if you heard about fibromyalgia, which is the
Yeah.
fibromyalgia is the poster child of nociplastic pain. Okay, they feel pain all over the body, everywhere, all the time, and there's nothing wrong with their body. It's a problem of the alarm system. If you get someone who is healthy and you want to tell them, I'm going to do something with you and you're going to experience what is to live with fibromyalgia, easy. You either reduce their sleep a lot or you make them sleep a lot. So if the person sleeps more than 9-10 hours every day for a couple of days, they're going to feel like a fibromyalgia.
Interesting. How come?
Because during the sleep, first of all, fibromyalgia is a disease of that alarm system, okay? And there are many different parts of the pain system, the alarm system that can malfunction. And fibromyalgia, they have almost all of them, it's malfunctioning. And one of the parts that is malfunctioning is the person does not have the ability to suppress pain sensations. It's called we have our inner pharmacy in our brain stem that produces our own analgesics, produces our opioids, endocannabinoids, endorphins, our serotonins, and many substances that are important for us to fight pain. So the person with fibromyalgia, they have that mechanism is not properly working. So and that pharmacy that we have in our brain, first of all, it needs good nutrition to produce those pharmacos, and second, it needs sleep to create like the storage of those, because we use those during the day and then you need to sleep to store those pharmacos back again. So if the person sleeps and they are in a very fine balance, they need to be, because we have pro analgesic substances, but we also have substances that are pro pain. So you
Mm.
have substances like glutamate and substance P that they increase the sensations of pain in our nerve system. And then you have others that are analgesic. So they need to be in balance. So if you sleep too little or too much, you're going to mess up with that balance. And then the person doesn't have the ability to fight any sensation of pain. And right now I'm sitting here, I'm not feeling pain, but somewhere in my body something is being compressed because I'm sitting, so my muscles in my thigh are being compressed. They should be hurting, because if I'm sitting and compressing them, they don't like that. Muscles don't like to be compressed. Why am I not feeling pain? It's probably because my pharmacy is releasing those information, those of neurotransmitter, and say, okay, it's not time for her to feel pain, it's okay, she's safe, and she's just sitting. But in a person with fibromyalgia, like if they raise their hands, arms, it hurts. If they sit, it hurts. If they walk, it hurts. They don't have that ability to suppress pain.
My parting question to you would be, what would you advise family members, friends, co workers, employers to keep in mind when someone is experiencing chronic pain? What can they do to help?
Yeah, a lot. A lot of things. So first thing is, if someone tells you that they are in pain, believe them. It's very, very rare that someone will be faking it. It's hard to fake it. You need to be the best actor in the world. like an Oscar winner level of actor to be faking this all the time.
Mhm.
So first of all, believe them. Don't minimize their what they're feeling. Second is don't offer judgment, don't offer explanations, don't offer advice of the type, oh, you just need to exercise more, or you need to get off of the bed, or you need to think differently about your pain. They probably know that. They
Yeah.
probably know those things. It's just hard for them to do. So what you can do is ask them what they need. Ask them, what do you want to do? And help them to do what they want to do. So if they say, I will just give an example here, but it could be that they say, well, I think I should lose weight. I'm convinced that if I lose weight, my doctor told me that if I lose a few pounds, I will feel less pain. We know that losing a few pounds can help a lot for people with chronic pain, but they can't. They try and they can't. So ask them, what can I do to help you with this? And they may say, stop buying those junk food and stocking our cupboards with them. I know you want to please me. Thank you very much. You love me, but bringing those donuts and cookies is not helping me. I know you want to do this, and also the person may feel, I'm suffering a lot. I need to indulge myself. This is my comfort food. I'm going to eat all of those. So having that kind of conversation, honest conversation, some people will say, I know I need to walk more, but it really hurts me when I walk. So maybe the family member, the caregiver can say, okay, would it help if we go together and I help you? And maybe I'll be distracting you while you're walking. I'll be, talking about how my day went, and we can talk about the next movie we're going to watch. And then maybe you'll be distracted and you'll be able to walk a little longer. So ask them how they need help, because they probably know what they need to do, what they need to change. If they need to change their sleep, maybe they say, well, my doctor, my nurse, or my physiotherapist told me that I need to do a better sleep routine. Okay, so the partner can say, what can I do to help you? Let's go to bed every day at the same time. I'll help you with your routine. Now, if it is a coworker at work, they can do the same thing. They can say, I understand you are in pain. You have this chronic pain. What do you need? What did the doctors tell you that you need to do? And is there something that I can do for you? Maybe your doctor told you that you need to quit smoking because smoking is killing you and is making your pain worse. What? And the person will say, yes, and it's so hard for me to do this. And the coworker may just say, okay, so when you go out, I notice when you go, because they go outside of the building to smoke, maybe the coworker can offer, okay, I'll go with you. And instead of you smoking, we are going to eat some carrots together and talk about it. And maybe that will replace one cigarette. So there are simple things like that. They can, if they ask honestly, they will get some suggestions.
I think asking, first of all, that means that person's very brave to ask for help. So I appreciate that that person's taken the first step at least. And then what can you
Yeah.
do? At least be empathetic and not judge and try to be a facilitator of the solution, whatever that is. Um, Thank you so much, Dr. Furlan. Again, I would highly recommend to all our listeners to please buy your two books. We can see that in the screen. And to understand the mechanism of the very first symptom when your body or your mind is asking for help. Thanks for making time today and sharing your expertise, Dr. Furlan. Take care.
It's my pleasure. Thank you for inviting me.